Good afternoon. My name is Kim Suderman, and I am a consultant for the County Behavioral Health Directors Association. And I wish I could see you all. I wish we were all in person, but thanks to COVID, we are not. But we are moving in the right direction. So that's really exciting, particularly California is. So we're really excited to be here today. Wanted to make sure, again, that let me tell you a couple of things. We will be having the presenters speak, and then we'll take questions at the end of their presentation, but feel free to go ahead and put your questions in chat during the presentation so you don't forget what you wanted to ask, so that it fits with the categories, and we'll be happy to go back. Today we have Adrienne Chambers, Deputy Chief Probation Officer from Alameda County. Adrienne, raise your hand. There she is. Awesome. And Jill Jacobs, who's the Executive Director of Family Builders. There's Jill. And Jennifer Rexroad, Executive Director of the California Alliance of Caregivers. And Jen, you're down. There we go. So I really want to thank you for all being here today. This is a really hugely important issue and topic for probation and for the youth in California who unfortunately do sometimes need foster care. And the ability to provide really good quality services is so critically important. So we're going to start off with Adrienne and Jill. I think Jill is going first from Family Builders, and then Adrienne from Probation will follow, and we're going to let them present first, and then after that we'll go to the next topic, and then we'll do discussion at the end. Take it away.
Good afternoon, everyone. Thank you so much for being here, and thank you for attending this session. As Kim said, I'm Jill Jacobs. I'm the Executive Director of Family Builders, and we are based in Oakland. We serve the broader San Francisco Bay Area, and Family Builders is an FFA and an adoption agency. Family Builders' mission is permanency. And the very end of December of 2016, literally December 28th, I received a phone call when I was home on holiday with my kids from a colleague who was working with Alameda County Juvenile Probation, and he knew of our work for the last 5+ years, implementing the resource family approval process, because we were working with one of the early implementing counties. And if you've been around for a little while, you know that the resource family approval process went into effect in January of 2017. That's when it became a mandate for child welfare and for juvenile justice. So we had a meeting, literally the end of December, and we offered two things. And this is a collaboration that in a minute I'm going to talk about where it is now, but it's been a work in progress. We're actually in year 5, and we've sort of built this plane as we've been flying it. We didn't start out knowing exactly what either of us needed, but we went into it. Family Builders brought the expertise in the resource family approval process. We've been doing it with caregivers, relative caregivers, and other families for a number of years, as I said. And our mission is permanency. And so we don't really go into anything that doesn't have a permanency element with it. So what I had proposed to the folks at Alameda County was that we would be happy to work with the probation caregivers. And we also wanted to provide permanency services for youth that did not have permanency identified, that they did not have family to be with. And so we have two parallel processes that are very overlapping and combined. When a relative is identified through the juvenile justice process mechanism, which Adrienne can talk about, they're referred to us, and we work with the family to get them through the resource family approval process. And for folks who've been doing that, you know, it's cumbersome, it's difficult, there's a lot of elements. And if we have a youth waiting in juvenile hall or somewhere else for the family to get approved, we want to get that family approved as soon as possible. So we've learned some lessons, and we actually have a staff person now that's dedicated to working hands-on with the caregivers, literally to walk them through every step of the process, calling them and saying, you know, Miss Smith, today's your CPR class. You got to get there. You got to be there at 10. to keep families getting through the process. You all know the requirement in terms of the timeline. It's too short. It's not reasonable for anybody. And so we do our best to get the families through in that time frame. And then at the same time, when a youth is identified in the system that does not have family, then we go into our permanency mode. And Family Builders has a model that we work with that we've used in both child welfare and juvenile justice now, where we work with youth to identify a permanent family, a permanent resource for them. So when they leave the system, or even when they're still part of the system, they have family. We all know youth outcomes are much better when they have identified family and they can be with family. We do family finding, we do engagement, we prepare families for accepting placement and parenting a child, and we work with the youth to know what it's like to be in a family and prepare them to be a part of a family. Adrian, do you want to jump in with anything at this point?
Excuse me, I absolutely can. I can just really speak, and coming into Alameda County, the relationship, as Jill stated, was really established with Family Builders prior to my arrival. And a large part of that had to do with, as I'm sure a lot of you are aware who have been working with placement and in continuum care reform, probation did not have the ability to process the number of referrals that we were receiving for out-of-service care, out-of-home care for our resource families. That gap was identified, and based off of that, we did seek Family Builders or seek someone who could provide that assistance to us. And, you know, I think that within probation that we've tried to do a lot on our own. And there are a lot of mandates that are required by the state that are very time consuming. They're very encompassing. A lot of the mandates were very unfamiliar to probation, not so much from the child welfare side of the county, but for probation, definitely. And so I think that a lot of counties have assumed a lot of these responsibilities through their own departments, whether it's, you know, a DPO providing the service or a social worker providing the service. But I just want to add to what Jill stated. There is some benefit, or actually there's a huge benefit in probation departments creating that partnership with foster family agencies. There is a lot to be said about that relationship that you can build with them in regards to permanency for the youth that we serve. Even at an earlier stage, Family Builders is incorporated into our department in providing services long before we even reach the point of out-of-home care. So that is a huge benefit to our department, because ultimately our goal is to keep our youth in the home. And so they are, you know, there with us even from family findings before we even get to an out-of-home placement order.
Adrian, can you comment a little bit about, you said there were mandates that you had to learn about that are actually that Jill's agency, for example, is helping with, that Family Builders is helping you address?
Absolutely. And I'm going to try and remember, because I feel like I've been through Continuum Care has been around for a while.
Right. And Jill, you can jump in with that too.
And those who have been, you know, in placement and working with that the population, I think the standards for, you know, youth being in a home for probation prior to CCR and its implementation were a little bit looser than what the mandates are for resource family approvals. We did not have those strict requirements that CDSS has implemented with CCR and the resource family approval process. So probation, although, you know, placement has always been stretched with serving our population, it was a little bit easier for us to be able to gain the approval of the courts to be able to place a youth in the home of a caretaker. And so that's specifically what I was referring to. And I don't know, Jill, if you wanted to add anything extra to that.
Sure. I think that, again, we have a family developer who works hands-on with the families and can really kind of hold their hand through the process. And families that come into this situation are often, they didn't plan on taking their 17-year-old nephew or grandson. This was just kind of happening. Their life isn't organized. They hadn't had a plan for it. This is real different than a family that comes to our adoption program that wants to adopt a toddler. Okay, we can give them the packet of information. They do it over the weekend and bring it back. When this has just kind of been dropped on your doorstep, it doesn't work that way. So really that support, that hands-on support, and we've increased that. I mean, one of the things we've learned over the last few years is that we do need to increase that support and have that person that can do that. Another example would be around training, that there's now a requirement that resource families have pre-service training. And sometimes the families can't get into the class that's happening, or the class doesn't happen for 2 more months. And when we started this, there was no online training for caregivers. Now there is. And at times early on, we actually would send a social worker out one-on-one to do the training with the family in a home. We've had family members, grandparents in particular, that were not mobile and couldn't come into the agency, to do training. And so we would go out there and we would do it one-on-one to get them through the process. Pretty much looking at whatever barriers come up and then figuring out how can we get them, the family, through the process and overcome that barrier. Another thing I really want to emphasize is that this process is a collaborative relationship. It's absolutely a partnership. It's not just a service that an FFA provides for probation. Lots of FFAs provide placement and other services, but this is truly a collaborative relationship, and collaborations require investment. So part of that is investment in time, which means we have to have regular meetings and sit down and talk about what's going well, where there's bumps in the road. We need to build trust with each other. We need to be able to have communication. So when there is a bump in the road, we can, I can pick up the phone and call Adrian and say, hey, how can we work this out? What can we do? There's a lot of sticky issues that come up working with the youth and the families at times. And so we need to make sure that we have really clear communication and open communication so we can do that. The other thing we do is, and this is our permanency model is based on this, is we have co-location. So probation was able to find a workstation, a cubicle for our staff person. And so she's on site there, and that really, really helps with communication. Everybody's busy, everybody's busy, hard to respond to emails, hard to pick up the phone. So she is on site. She has access to the probation system database, which is tremendously helpful. We can see history of placements and other information. And, probation officers can pop in to see her, and she can, try and grab somebody along the way if she has a question or a concern. Another place that's been really helpful in the collaboration is the SOS meetings. And Adriana, I'm embarrassed to say, I don't know what that is. Can you explain it? Maybe everybody in probation knows what that is. But.
Yeah, I can definitely take over, and I'm sure that a lot of probation agencies are familiar. This is our screening for out-of-home services. So typically, when a youth is being considered for out-of-home placement, there are a lot of agencies that already conduct these meetings, staffing, internal, and I think it can really vary, who those participants are depending on your agency. But what's been really key to having family builders as part of our team is that the identified liaison for probation who assists us with our RFA approvals is present at the time of our screening for out-of-home services. So we have, usually there's a probation director there, the placement unit supervisors there, the staff presenting the case. We have behavioral health. We have a few of our community-based organizations that provide intensive wraparound services to our youth. And then we also have our probation liaison from Family Builders is there as well. So when we're discussing all of our placement options, with of course the, least restrictive being the first identified choice, we're able to have those open conversations with our liaison in regard to whether or not that youth can safely remain in the community, and if we need to begin or have further discussions, because technically our family finding should have happened before then. But if we need to have further discussions in regards to whether or not there is someone in the community that the youth can reside with outside of the home of their parent or guardian, we can have those discussions there. And if the decision is for the youth to receive an out-of-home placement order with a potential RFA, then the liaison, is able to begin that process at that time.
It also gives our staff just access to the background information and being at the table with everyone else in understanding the history of the situation and what the youth's needs are. We also provide training as requested. If the department wants training on permanency, we've been providing that. We can provide consultations. So sometimes a probation officer, a social worker in the department will just want to do a consultation with our staff around a particular situation or scenario. So we're available for that. And we can participate in work groups. Pandemic has kind of put the kibosh on that to some extent, but when all things are opened up again, we hope to be able to do that a bit more in person. And then part of the collaboration is a commitment to working out what I call sticky issues. So an example of a sticky issue is the level of care. So Adrian's smiling, we had a conversation about this recently. Sometimes it looks like the static criteria says that you should automatically be in the ISFC level of care. And we're trying to provide, to prepare the caregivers to be able to be an ISFC level caregiver if that's needed. And Adrian says, well, let's talk about the behavior. What are the needs that youth has? And if it has a need to be at that level of care, of course, but it's not automatic. It's not a blanket. And so, we go through that process and we figure it out and we come to some agreement about what's workable for everybody.
So can I just interject? It sounds like then that being at the table at the time when they're first discussing what level of care the youth needs makes a big difference for you as an FFA as well as for probation, meaning it doesn't slow the process down. There's not the extra step of now making a referral and figuring out, and again, repeating that same information. You're hearing it at the beginning. It sounds like that is helpful, Jill, for you guys.
I'm not even sure that's when we determine the level of care, because there's usually a lot that happens between that initial
Sure.
And then getting to it. So I think it's over time, but Adrian.
Okay. Well, I just meant that way you're not starting from scratch, hearing a case to determine what you think, but you're at the table from the beginning is
Yes.
making a difference.
Yes.
And I definitely agree. There's times where we have our screening for out-of-home services, and probation may feel that the youth would benefit from a different level of treatment, whether it be an STRTP or our Camp Sweeney program. And we send it to our recommendation to court, and court decides they would rather have the youth with a family member. So it really saves us some time and having to actually, quote unquote, rescreen the case and describe all the details and start from scratch. If it does go down that road, then our liaison already has some background information on the youth.
One of the things I wanted to mention is that Alameda County has provided a contract with Family Builders for part of the services, as there's a sort of a collaborative funding stream here. The contract that we have with Alameda funds a full-time social worker to do the permanency work, to do the initial intake and assessment of the potential caregiver. And it funds the person the family developer who's, supporting the family through that beginning of part of the RFA process. Once the family is approved, if they're going to come into Family Builders FFA, then we're able to draw down the FFA rate. So having that upfront funding is really important, because one of the things that happens with this population was one of the challenges. Give you a great example. We worked for 9 months with a grandfather who was a little curmudgeonly and didn't want to do this and didn't really want to take the youth, but was kind of coerced into it. And so he went through every step of the process, very begrudgingly. 9 months. We got grandfather approved, and within 2 weeks of placement of the youth reoffended and AWOL'd. And without the contract, that 9 months of work of my staff's time would not be funded. And so you can do that once a year or every now and then, but you can't do it on an ongoing basis and sustain your agency because you're putting out this resource. Normally in an FFA placement, we don't receive any revenue or any funding for placement until the placement is made. So all that front work, recruitment, the preparation, the training, getting the family through the resource family approval process, CPR classes, fingerprinting, we don't get paid for that until placement. And so having this upfront funding in the contract is what's allowing us to do this. So it's very tragic, and my staff's frustrated and I'm frustrated. We put so much time investment into grandfather, but at least it's not creating, a revenue shortfall for us, and we can continue to do this.
And it sounds like, so you gave it the best good college try you possibly could.
Yeah.
And probation, it sounds like that was still money well spent from your perspective, because at least for those 9 months, he wasn't reoffending. Is that correct?
No, actually the youth was not in placement during those 9 months. The youth.
No, I know. Where was he in this situation?
I don't know if he was at Camp Sweetie or in juvenile hall.
Okay. So, but you were working with the family. So probation, would you feel like that was money well spent, even though absolutely for the FFA, that's huge in getting to do the work to do some good sound training. From probation's perspective, was that money well spent?
Absolutely. I think, Alameda County is, of course, we're not as large as Los Angeles County, for example, but
No one is.
We're a fairly large county. In our placement unit, we have a unit supervisor and then 2 probation officers that are specifically dedicated to RFA. And it's a lot of work for the supervisor and for my staff, the 2 DPOs. And I really commend the job that they do with the population that they're dealing with on a day-to-day basis. And so it really is beneficial to have that service, to have family builders, even if it takes 9 months, even if it never comes to fruition. From a staffing standpoint, it really assists and frees up those DPOs so that they can actually provide that community supervision. I know that some counties are utilizing probation officers to do that process. But for us, I rather have my staff focus on providing the services in the community to those youth, as opposed to actually going through that process. In addition, it also relieves us because once the home is approved through family builders, technically it is their home, but it relieves us of that ongoing update for RFA. And it also leaves us with a resource. So even though technically it's not a probation approved home, we have a great working relationship with family builders. So in the event that we do have a youth who has to be placed, we have that option of reaching out to family builders to search for a placement for that youth as well.
That's great. And had it been successful, that time put in would have been very good for the youth as well. So, when we look at what's best for the youth in this situation, that would have still been much better. And you can go back to court and say, well, we did everything we possibly could.
And we have had other caregivers who have gone through the process, the youth's been placed, and the youth disappears for a bit, but they come back and the caregiver is approved and they're still approved, and we keep it open, and the youth can come back if the court is willing to allow that for the placement. So I think it is definitely time well spent.
Awesome.
And just to add, I think the other benefit of the collaboration is we do, our county is very resource rich. And we have a lot of additional services that we can use to partner with family builders to help the families. If family builders if they're approving a home and they know that there are items that are missing out of the home, or they've identified a need for service for the youth or for the family, we often provide a lot of those resources. We have programs here that are still, I believe I've probably talked about them before, but for example, our Breaking Barriers program is still being used here in Alameda County. And basically what we do is we assist families who are in financial need so that the families can focus their attention on their involvement with the youth in the home. So we do things such as assist with paying rent, or we pay utility bills, or, you know, we pay for classes, whatever is needed to keep that resource resource families, we're all big community, and we use those sources for anyone that we can that comes in contact with probation.
And our contract with probation also allows us to pay for fingerprinting for any of the adults in the home, for the CPR classes. We could provide a reimbursement for childcare if there are children in the home when the family needs to go to training or to meetings. We could reimburse for that. So removing all the barriers, there is no financial barrier to doing this, and obviously there's a financial incentive and benefit to the family for taking the youth in.
Awesome. And is your contract with, is that your only contract with the county, or do you also provide Medi-Cal specialty mental health services?
We are not a mental health provider, so
okay,
we are not a provider.
So that FFA piece is huge in being able to provide those resources up front to get those families ready.
Right, and we also, if the family is approved and the youth is placed, then they're placed in Family Builders FFA. And so then, as Adrienne was saying, we do the case management and the supervision. So we're in the home, we're attending the CFT,
Right.
We're doing the collaborative work with the PSDT provider or the wraparound provider or whoever the other providers are involved
Right.
with and providing those services.
Okay, awesome. Anything else either of you want to share before we shift over to Jen?
Just two other points around challenges. One of the things that's come up is, and this has come up in another county, not all the judges got that email about RFA. And so sometimes the judges in court will mandate that a youth be placed with a particular family member. We had a situation where godmother went to court with the young man, and she was the person in court supporting him, and the judge knew who she was and ordered that the youth be placed with godmother. And we go out to godmother's home, and she has a 1-bedroom apartment where there's 8 people living. And so, sometimes there's those tricky things, and that fortunately, we don't have to navigate the legal aspect of that. Probation department does that, but those situations can be tricky, and everybody has to work together to figure out, what we can do and what we can't do. And I think the other thing is just making the commitment, the investment in time that we all have to put into this. It's a new relationship, it's a new process, and we have to be available to each other. We have to, agree to some times for meetings so that we can work out any bugs in the system.
Awesome. Adrienne, any last comments?
No, I don't. Just, and I know Jill, brought up the frustrations that I'm sure many of us encounter. Sometimes there's just things that we can't get around, and we still get orders for, out-of-home placements for places that are not appropriate. And those are challenges that we will just have to continue to deal with. And I'm sure that each, county has their own set of challenges, and ours is probably not a unique one. But we work through it, and I think that's what makes us good at what we do.
Sometimes, one last thing,
Sure.
the DAP process, the DAP process to work around some of the placement regulations, usually around bedroom space. Sometimes we can get a DAP and sometimes we can't. And I think there's a little bit more flexibility for the probation department to be able to get a DAP. So sometimes we'll do the family evaluation and the training and the preparation for the family. And then we kind of have to hand the family over to the probation department to do the case management and do the follow-up because we can't get a DAP. So again, we work through that. We do the parts that we can. So we can do the family evaluation. The probation department does not have social workers to, whose job it is to go do assessments of families. And so we can do that. And then the probation department has to take over the management of the case. So.
Well, great. Thank you both for the work you're doing for youth. It just sounds like a great partnership. So thank you. So let's shift over to Jennifer Rexroad. She's again the Executive Director of the California Alliance of Caregivers, and Jen is going to do a presentation for us.
Good afternoon, everyone. I'm Jen Rexroad. I'm one of the founders of and the current Executive Director of California Alliance of Caregivers. We were founded in 2016 by foster and kinship parents and other child advocates in order to bring the caregiver voice to Sacramento for policy and program improvement for foster care. And so since 2016, we've been working with caregivers and caregiver leaders around the state to basically collect their voice around what is working and what they need to provide stable homes for children in foster care so that they can heal and thrive. And I'm going to be sharing today a few things that we've learned and about some of the work that we do to support resource families. I myself was a foster parent for about 7.5 years. And last fall, we just decided to go on a break for a while. So we're not currently fostering, but we fostered very young children and then teens, some who had cases in probation or coming out of probation. And so I've had personal experience supporting youth in the probation system, and several of our members and some of our leaders have as well.
Jen,
So,
are you going to be sharing your screen?
oh, I'm so sorry. I thought I had. Here I have it. It's on my computer. Sorry about that. Hang
No
on.
worries.
Thank you for.
There we go.
There we go. Okay, here I am. This was my screen. So our leaders around the state, we call them California Alliance of Caregivers ambassadors. We meet twice a month. We meet one time just with each other to share information, and we disseminate information coming from the state about new resources or policies, events, and so on. And then we meet with the Department of Social Services one time a month, and we have an ongoing list of barriers and issues that we seek to address. And we like to give them ground level information on what is needed and how things are going. And this was actually incredibly helpful, I think, during this past year. Obviously, there were a lot of unique needs of caregivers that many people, may not have thought of, nobody thought of, obviously, before the pandemic. So we were able to quickly kind of bring some of these issues and needs to the forefront to see how those could be addressed. So over the last several years, we've kind of come to think of a support continuum within our continuum of care continuum for resource families. And we truly believe that if a resource family is supported and if their youth is receiving the services and resources that are needed, then that's really the best chance to provide a stable placement. And we, I think like everyone else, would love to see a youth in a stable placement and not have that placement change, because the numbers and the statistics show that the outcomes become, poorer and poorer as a youth, has multiple placements. And so we envision supports that are available for families on this continuum, and that families may need to access the different services at different times during their placement. So it could be that a family needs more services and support at the beginning of the placement, really intensive services and hand-holding, somebody giving them continuous information. Some families may, a relative family may be in a honeymoon period at first, and they don't foresee a lot of need or have a lot of immediate questions or needs. But then once kind of the rubber hits the road, so to speak, they all of a sudden may find themselves in crisis and really searching for where to find support and information. And so one of the I think one of the maybe the easiest and most important supports for all resource parents, but I think in particular resource families who are caring for youth in probation, is a caregiver support group. Our organization does offer regular facilitated meetings, and there are others out there as well. We're certainly not the only one. I know that many of the foster family agencies offer support groups, and so do other organizations around the state. But we really want to make sure that, and I'll call out especially relative caregivers who come into to foster care, to come in to care for a youth. It may be, last minute with no warning. They're scrambling to get their house set up and to take the necessary classes, to check all the boxes, so to speak, and may not have an awareness of a support group around them or people that they can reach out to ask questions. And so we really like to see caregivers connected. So it wouldn't necessarily need to be a resource parent for probation youth with other probation caregivers. They could be in any resource family group. But I think that's really important in a way to have a safe place to ask questions, to get information, and to have that moral support. So we actually started our virtual support groups at the beginning of the pandemic last year, because we had heard from so many caregivers that they were kind of in crisis because they felt this intense isolation. They did have a lot of questions, but a lot of them didn't even have another adult to talk to during the day. Their entire days were kind of filled with meeting the constant and very intense needs of the children that they were taking care of. And just this outlet of being able to talk to other parents was incredibly beneficial to them. And so we would take their questions, occasionally have staff from the Department of Social Service come and bring information. And then there were some parents that we needed to do some follow-up that were a little bit more in kind of an acute stage of crisis. So we just wanted to make sure that whatever the issue was, that we can't provide all these services. We don't do that, but we try to connect caregivers with other community-based and other services. Another support that might be a little bit higher level is one-on-one support from other caregivers. And so I'll call out, and if you're from, various counties around the state, and I don't call out your county, it doesn't mean that they haven't done this, but one county that we were very impressed with is Stanislaus County, who used their foster parent retention, recruitment, and support funding to hire resource family liaisons. And they have 5 liaisons now. I believe they may have another one. And these are experienced caregivers who are available to provide that peer mentoring to new or current resource families. And so we believe this is incredibly helpful for county staff, because the resource family liaisons can quickly and easily kind of answer some of the lower level questions that may take up a lot of time by other social workers. And I think they really help to stabilize placements and connect the caregiver with resources or tools to deal with whatever problem that they may be facing. Also in California, there's something called the California Foster Youth Initiative. And this is a partnership with AmeriCorps, where California is using AmeriCorps resources in order to help support foster care. So there are many AmeriCorps foster youth that are providing mentoring to other foster youth. There's a program in Northern California largely, and then in Los Angeles and Southern California. And in addition to that, there are some caregivers. They're called care service partners, or caregiver advocate and resource educator, who are available to answer questions and help support caregivers. So this is more of a little bit more intense than a caregiver support group, the peer-to-peer mentoring. And resource families may need both. They may want to go to a support group and have a peer mentor. And a resource family liaison is again a county employee or a contract position. So I know many of the foster family agencies have these as well. They're, sometimes they're employees of the county, or it could just be more, sometimes they're largely volunteer, which we obviously would want them to be more of a position. But in the other counties that have these as well, I think they provide a lot of help and support to the resource families. Mariposa has one, San Francisco has some, and there are more counties as well. They may not be called a resource family liaison either. I don't believe they're called that in Stanislaus County. That's actually our term that we've kind of given to the broad group of people, of current caregivers that are current or former caregivers that are designated to support resource families. Training is another key, a key component. And so most all resource families around the state have access to foster and kinship care education. And one of the silver linings of the pandemic is that the training that many of these programs provide they've been on Zoom. So really any person in the state, whereas before they might have, well, I think they almost always had to drive to a community college location probably near them. Now they can attend any of the trainings around the state. A lot of those speakers and trainings are amazing, and it could be a really expensive, great speaker that one county has paid for and provided, but now all resource parents across the state technically can attend. So the FKC is the acronym that it goes by, Foster and Kinship Care Education. Those classes are extremely important. Probably most of the resource families are going to go through that training through there or foster parent college, or a hybrid of the two. And then ongoing placements specific training, and especially for intensive services foster care, is needed as well. So I know that many of the agencies, again, provide that training in order to support a family and train them to become an intensive services foster care family. But training is very important, and I think may be a little bit of a gap for this population in particular. I know of families who have had a tough time finding kind of the more specialized training that they need to address the needs of the youth. So that's one area. I think as much as that training, if somebody is doing a specialized training, and that can be shared with the broader community so that as many parents as possible can access it, is pretty important.
And Jen, is that something that if the families are going through a foster family agency, they can get, or do they have to find that on their own?
So you mean for intensive services foster care?
Yes.
Okay. So this is how I understand it now. And Jill can correct me if she knows something different. I understand that 5 counties have public intensive services foster care programs, meaning the county is providing that intensive services foster care in-house. And then I guess the county would be providing the training, or they would have a contract with another foster family agency to get the training. Then I believe that the foster family agencies who are for doing ISFC. So if a resource family is an ISFC family or certified or approved for ISFC through the agency, then they would be doing the training for that within the agency, or perhaps partnering with another agency. But I think with that, we were part of the ISFC work group when that program was being developed. And the idea is that some of that specialty training really be specific to the needs of the youth, right? So you're providing a higher level of care. And if you think of all the different needs of youth, that's a lot of specialized training. So sometimes a caregiver may want a certain type of training, and sometimes, because, for whatever reason, they may have to wait 6 months until that training is available, or maybe the training isn't offered at that foster family agency. Jill, do you want to weigh in on that?
Sure. I think for the pre-service training, most FFAs prefer that caregivers go through their organization, because part of what's included in the pre-service training is kind of the rules of the road for the particular organization. But then if the caregiver's needing to do the full 40 hours for ISFC level of care, or the ongoing training that all resource families have to do, most of us allow our families to go wherever they can get the training that works best for them. And there's a lot of collaboration between FFAs in the Bay Area, there's a number of FFAs that have Title 4E training contracts. And so they open their trainings up to all resource families and all staff. And there's collaboration around that. As you said, many families need very specialized training. So they're working with youth that maybe have been exploited. So they need training around CSEC, or youth with particular medical needs or behavioral issues or whatever they are. And we try and help funnel the families into the training that they actually need. And as you say, every agency can't provide all training. So we really work collaboratively to get families connected to the training. And you also mentioned the community colleges, which is another place. We've had families go to Kaiser for training because Kaiser was doing a series of training that was, relevant for the caregiver. So most of us, I think, are pretty flexible about where families get those additional training hours.
Thank you.
Thank you, Jill. And yeah, that's another benefit of a partnership and collaboration with the foster family agency, because with their collaborations within that community, the caregiver is hopefully able to access as many choices and types of training as possible. And I always think that if a caregiver wants and is asking for training, we absolutely have to give them training. We want people to learn how to provide the best care for our youth, and to meet that need, of course. So another top need is a care line for immediate needs. And so there have been in various counties care lines or rapid response lines prior to the pandemic. And then we had more support even at a statewide level during the pandemic. And then I'll call out right now, in case you haven't heard, that the Family Urgent Response System was launched on March 1st. And this is a statewide hotline for resource families to call if they are in crisis and need help de-escalating, or they need on-site help, and so on. So the care line is dispatched from the state to the county. So each county has a program in place, and they have providers that are able to come out to the house to help de-escalate a situation and bring that crisis support to the family when it's needed. And it was really intended to prevent calls to law enforcement. No offense to all of you, and to have kids admitted to a stay in the emergency room. And so so this is called FERS. The acronym is FERS. And that is available to all current and former foster youth. So current resource families. And then once a case is closed, if the youth has been in foster care, then that family will qualify afterwards as well. And so this is a new support, and we are watching and hoping that families access this, and that it will help to bring a more trauma-informed approach to crisis situations. We believe that one of the top levels of support for parents are parent coaches. And this model, in my mind, I picture, after having worked with a parent coach who was a clinician with training to help parents build skills for behavior modification, de-escalation, and therapeutic parenting. I found that working with a parent coach for even just a couple hours just provided an amazing amount of insight and confidence and perspective to being able to handle tough situations and behavior. And this I know, and Jill, after this, you can speak to this as well. I know that some foster family agencies offer this type of support, access to parent coaching. But I think it's one of the best ways to, one of the best bang for the buck, so to speak, is to, if a parent is willing to work with a parent coach, especially around certain behaviors, that is, that's can provide an amazing result, I think, in the parent-child relationship, and also in healing, because we know that kids who suffer from trauma, their best chance at healing and thriving is really through relationships. And navigating a healthy, stable relationship has got to be kind of at the top of the list of what we want for our youth.
I would certainly echo that. We don't have a formal coaching program, but as you said, a number of FFAs do, and some of the counties also do. And as you were talking, I was thinking about the two teenagers that I have raised that are now young adults. And I was thinking, wow, wouldn't it have been great at certain moments to have somebody to be able to call and say, help me through this. I was a single parent raising my kids. So yeah, I absolutely think it's a wonderful model. And it's also, one of the things I was thinking about in probation versus FFA is one of the advantages that we have is that we don't carry a badge. Our staff doesn't carry a badge, and our staff are all social workers. And, we're reporting to and working collaboratively with probation department. We don't make any, secret about that. But then I think when you go into parent mentors or parent coaching, it's even one more layer that's removed from the formal agency. I think that's one of the strengths of the FERS program also, is that people can be a little bit more open, a little bit more candid, and get a level of support that maybe they wouldn't get from the quote unquote professionals.
And we added our CEC ambassadors, our leaders around the state, and they kind of bring that caregiver voice and need to collaborate with the Department of Social Services and really to improve statewide resources. Currently, we're working with the state on a monthly webinar series, and these are around policies and the top questions that caregivers have. And those are just amazing recorded resources. One of them is on navigating the court system and how to bring information to court via the JV 290, how to fill those out, what happens, what kind of information you'd want to bring to the court to inform the judge of the use progress and so on. Then on foster parents and education, kind of the information that they need and how they can help their youth, how they can advocate for their youth. And then our last one was on caregivers and the foster care bill of rights. So in having a discussion around some of those foster youth rights and how caregivers can best support them. So they're really trying to inform and support caregivers in that way. So again, we truly believe that supported resource families provide placement stability, and we want kids to kind of stay put where they are. If, once ideally or hopefully the best placement for the youth is found, and I'm sure you've seen this, or hopefully that statistics show that youth really do best when they're placed with a family member or somebody that they know or have a past relationship with. And it seems like sometimes in family finding, the idea would be this youth has intense needs, so we have to find a specially trained ISFC family to support the youth. when really I believe that, and I think a lot of people have seen that it could be a kinship family that is not equipped to meet the needs of the youth, but with intensive foster care, and that training and that support and the services, that family can meet the needs of the youth. And Jill has her hand up. She may want to say something here.
Yeah, I really want to echo that. The problem with ISFC and professional foster parents is that they're professional, and at some point their relationship ends with the youth, whether that's when the youth turns 18 or 21, or when they're finished with their probation time, whatever it is. And that's, I'm actually not a big proponent of professional foster parents. We can find relative caregivers. We can find someone that knows and loves this young person, and then we can put the support and the services and the training and pour it into that family so that they can support the youth, and the youth's much more likely to be able to stay there long term. When you have a high level rate like we do for ISFC, it's actually a barrier to permanency, because the family can, if their life is arranged at that, high rate, and it's a high rate, they can't afford to have the youth step down or step out or do something different. So from a permanency perspective, absolutely positively want to support what you're saying.
Thanks. So some of the unique needs, I think, for resource families caring for probation youth, I know supervision can be one. If a family has, to tend to a sick parent out of town, or they have somewhere a surgery, or for some reason they need respite care or supervision for youth, it's not like you can hire your neighborhood, babysitter to come over like you might be able to with a younger foster youth. And so, and I found that the youth that I worked with, really to hold them, I call it holding the youth, not physically holding, but just, creating the engagement and the environment to stabilize them, so they're not running away, or they're not kind of falling off track. The supervision piece has to be a good fit for the youth, so it doesn't undo the work that has been done, and doesn't set them back. We became kind of a co-caregiving family with a couple of other caregivers, and we're able to be kind of the regular respite supervision person for a youth, a probation youth in our, were friends of ours and lived a couple blocks away. So it was actually a situation that felt normal, like another, teenager in the neighborhood, if their parents had to tend to something else, that they could stay at our house for a few days. So I know that some agencies have models where there is another family that gets to know the youth and does provide, it could be a mentor, it could be, just an occasional break for the family, but having other adults in that young person's life to provide that supervision when needed, or respite for the family is very, very important. Also, community for the youth. And we really like our, we would love to have community members, either family members, neighbors, anyone who is working with our youth who've suffered trauma, to have even basic trauma training. We've now started to provide a monthly training on understanding and responding to trauma, so that other people, when they see behaviors or they see things that happen with our kids, can view it with that trauma-informed lens and understand that that is the youth's way of of dealing with situations maybe because of their trauma, but having a trauma-informed community or, just even community with other people is so important for resource families so that they're not isolated during this, time of meeting maybe intense needs of a probation youth in their home. Connection.
Jen, does your agency provide any trainings? Do you guys as an agency provide any of those trainings?
We do provide training. Yeah.
And could a non resource family participate if they were planning to be that respite, that support to another family? Could they also attend those trainings?
Absolutely.
Okay.
Yeah. Yeah. And so that one, understanding responding to trauma, we can do that for an agency. So you can contact me if your probation department wants to do an understanding and responding to trauma training. We can do that for you. Or you can send people to the monthly one that we just have on our calendar.
Awesome.
Connection to information is so important. And we know that new resources and supports come along and there's social worker turnover. Not every social worker knows everything and, can expect it, and I'm sure the same with your probation officers. There's just so much information out there. So having access to networks or connecting caregivers with networks with other foster parents is really important so that they can connect to training and other tools and resources, best practices that are out there. And lastly, I'll call out or talk just a moment about intensive services foster care connection to services and rates. So I have seen and experienced myself a lot of very, very, very high needs youth that should really be in intensive services foster care and are at the basic rate, and families who are, going out of pocket to a great extent to meet the needs. And one of our current leaders, she was placed with a probation youth from another county at basic rate. And this youth had stepped down from a high-level congregate care facility with multiple kind of major behavioral health issues and other things going on. And I just, I couldn't believe it, but yet I could, because I had experienced something similar. But I think that I feel like especially relatives are at risk of not getting this support and not wanting to advocate for it because they feel like they're, I think maybe they just don't feel comfortable asking for the right level of support. And I think that these placements are at risk of falling apart when a family is asked to do, provide kind of the care for a high needs youth without the both the services component of it and the financial piece of it. So we would like to see more families access intensive services foster care. We hear all the crazy stories from around the state of youth who are in homes, and I do want to say that their resource families aren't professional in that they don't get paid for doing the work they do. They're really volunteers. So the rate is meant to pay for the needs of the youth in their care. So they're volunteers, and then they're reimbursed or ideally reimbursed for the care and maintenance of the child.
Jen, do you guys provide any advocacy or support to foster parents when you learn of some of those situations where you feel like they're really not getting the support they need, either how to talk with the probation department or how to talk with the FFA that they're licensed under, or the county if they're licensed under the county? Do you provide any of that, or have a recommendation of where those parents can go to get that advocacy support?
We do provide some support, limited. So we work mostly through our leaders and then would like them to deal locally. And in some cases, we can escalate it up to our partners at the state who really they can't obviously do that for every situation, but they want to be able to understand barriers and can help with the TA in some instances to hopefully kind of iron out future bumps. And so since the level of care protocol, it was being used by foster family agencies, and now it's being used for county homes as well. And that's newer. So we are kind of gathering the ground level information from families. And so counties have just started to put their assessment process. They've just started to roll that out. And so, basically, prior to a couple of months ago, if a county family had a youth that qualified for an intensive services foster care, the county would have to move that family to an FFA. In large part, they still do, but there are 5 counties that have public programs. That's still an issue that we would like to see that change so that a county doesn't have, or a family doesn't have to move their resource family approval. But I would say for the probation side of things, if it is a youth with higher level needs, it's, I would think you would want them to go through RFA with a foster family agency rather than through the county RFA program. Because if the youth did need to access those higher level services at this time, they would have to go through the portability process of moving their RFA to an agency. Whereas right off the bat, if you said this is a youth with a high level of need, you could send grandma, say, grandma's the best placement, so we're going to send her over to Family Builders to do her RFA rather than through the county, if that makes sense.
That's a really good point, Jen, and that I think will help probation and of course child welfare, but this is a probation discussion, in how they make that determination for counties that do have licensing programs with where the county operates it. So that's really significant, I think, and I'm hoping others are taking note of that, because those additional supports are critical. And really most of the youth today that are going to be that you're trying to keep them from going, particularly from going into an STRTP, you're definitely going to likely want that level of support versus a youth that just doesn't have a place to go in the first place. And if they had a family or relative caregiver, that would make a huge difference for them. But for those that we're trying to prevent a higher level bump up, definitely that makes a lot of sense.
And the intensive services foster rate is obviously less expensive than an STRTP, and it's paid for by the state. So the counties don't really have an incentive to ration that service. You would think the state may deny it, but the counties don't. So that would be my recommendation. Is I really like the the collaboration, the partnership with the foster family agencies, and they they really are providing a lot of support to their families and can. And we have, just to kind of highlight a few of our programs that your resource families can get involved with. We do a caregiver day at the Capitol. This year, we advocated on a bill for hidden foster care. And I won't get into that discussion. And also for a pandemic assistance for foster parents and an expansion of the Child Care Bridge program. So a lot of them are directly kind of county program related. We do coffee with caregivers. We just started a specialty coffee with caregivers for caregivers of CSEC youth or commercially exploited children. We are partners in Parents and Caregivers for Wellness. So we do a lot of training for all parents, any type of parent, not just foster adoptive guardian parents, around mental health and accessing those services and tools. And then we have our leadership program that I referred to earlier, the California Alliance of Caregivers Ambassadors. We're always looking for new leaders. If you know of a resource family that may be interested and be good at participating, we'd love to add them to our leadership coalition as well.
So is that kind of the end for you, Jen?
And I think that's it. And I was just looking at the chat for questions.
Yeah. So
I don't know if you want to ask me questions or.
Yeah, there are quite a few questions for both you and for Jill and Adrian. Since you just finished, let's do that. Jeff has asked, how are your services funded for you, Jennifer?
So we have, our largest funder is the Walter S. Johnson Foundation. We have individual donors. Our resource families, foster parents don't pay anything for any of our training or services. And we have a contract with the Mental Health Services Oversight and Accountability Commission for Parents and Caregivers for Wellness. And we have some smaller grants and contracts as well.
Great. And then you're a nonprofit, correct? So
we're a nonprofit. Yeah, sorry.
Yeah, you probably do fundraising as well.
We do fundraising. I'll put our donate button at the bottom of the screen. Just kidding.
Yeah, yeah, you should have put it in your PowerPoint. Okay, so then there's some questions for Jill in relation to family builders and how you recruit specifically for probation? Does Family Builders also recruit families for probation to use?
We do not recruit families from the community for probation or any other teenagers, to be really honest. We do have some focus on placing older youth. It's a commitment the agency has, but the most likely resource to come forward for an older youth is someone who is known to them. And that's where our permanency process comes in. So it's not so much recruiting from the community, it's recruiting from someone that is within the child's network. So birth family, and we actually go back and look at birth parents because sometimes they've been pushed far out away and maybe they can come back in. Birth family, extended family, community, and anyone else known to the youth. That for any older youth, for any teenager, that's the most likely resource.
So that's really significant in that you are definitely, for the probation youth, working through that kind of general family tree to look to see and doing within there, so they have a relationship in some way with their caregiver potentially. And
it's the family tree, but it's also teachers, coaches, social probation officers. Yes. There's a lot of folks that have a connection with the youth, that care about the youth. And they're a much better and more likely and a more committed, unconditionally committed resource.
Sure. And you would make that first contact?
We would.
Okay.
Right. We would. Absolutely.
Okay.
Yes, absolutely.
Great, great. And then there's a question from Anna. How many RFA homes have been approved for Alameda County probation? And what is the case? Okay, so part of that is, I think that's also for Adrian as well. But how many RFA homes do you have right now for Alameda County for probation?
I can't tell you that off the top of my head. It's a handful. It's not a huge
Okay.
number. Families kind of come and go.
Sure.
A lot dependent on the trajectory of the youth. And
Right. And for Adrian, beyond family builders, do you have others? Do you have a sense of how many RFA homes overall Alameda County probation has and kids in placement there?
Let me unmute. I know our total numbers in placement are pretty low at this time because of the pandemic. I think that's definitely affected our numbers. I want to say right now in placement in total, last looking at the numbers, I think we had maybe about 50 some odd youth on placement orders.
50 including, okay, and that includes
our
both.
RFAs, STRTPs and RFAs as well.
Okay.
Yeah, but the large number of our youth are actually, we have a large percentage are with RFA families.
Okay, awesome. And what's the caseload size for the staff members, for the POs that are working with family to provide support?
I know my staff is on the line. It's muted. I would say the numbers probably are about 20 at this time, 20 per person.
Okay, and then Jill, what's your staff's caseload size as they're working with the kids, so the youth?
it's up to 15 if it's youth in level, the basic rate to level 4. Youth that are at the ISFC level count actually as 2 placements. That's just the way we factor it out. So it would count as 2 for a social worker.
Okay, and then the question is the same social worker completing the approval that's the ongoing caseworker, or is that different?
In our organization, it's different. It's a different,
Okay.
It's one person that does the approval and another person that carries the caseload.
Okay. And for Adrian, is it the same PO throughout the process, or are they going to change depending on their status and where they're placed and what kind of care they're placed in?
No, we use as soon as the case is identified as going to a resource family, we keep them with the same individual, so they do not switch.
Okay. Okay. And then actually one of the very first questions was for you, Adrian, on the funding of actually it's a combination, funding on the staff that are really being doing that work up front that Jill was describing, the contract between your 2 agencies. How is that? Where's that money coming from?
So the question, I'm sorry, is how are we paying for our contract with Family Builders?
Yes. Yes.
Okay, so we had a large amount of leftover funding from our FIPers, which we're using to provide services by means of Family Builders. But even after all of that money is absorbed, we definitely see this as a critical service that, we could not do without. So once that money is gone, we will definitely have to find a way to continue our partnership with Family Builders.
Great. And then, so I don't see any other questions that others have asked, but I have a whole list of questions for you guys. And so I want to encourage folks to continue to feel free to add questions to the chat or raise your hand. And if I don't see a hand, just go ahead and unmute yourself and say, hey, I have a question. But meanwhile, I wanted to ask for Adrian, what makes you determine whether you will try a placement with a family where you see the youth as a very high-end service need and support? How do you what makes you shift from STRTP to ISFC, for example? How are you making that cut to decide where do you begin first? I know you said least restrictive, but kind of what helps trigger you either way?
I think for probation, we just have a different set of circumstances that we have to look at. Youth come into contact with us even for consideration for out-of-home placement typically because of an offense that they've committed. So we have a lot of factors that we have to look at in addition to where the youth can be placed. We have to always, take into account community safety as well as, what would be the best placement for the youth. So every time we have our screening for out-of-home services, the first option that we do review is it an option for the youth to return home? And can services be provided to the youth while they remain in the home of their parent or guardian? Which is why we have our community-based organizations that provide those wraparound services participating in our screening for out-of-home care. And then if that is not an option, we still consider, whether or not the youth can remain safely in the community with another caregiver, care provider. And believe it or not, one of our largest recruiters in identifying places in addition to family builders is our public defenders. They are great at finding additional locations that the youth can return to in the community. So we just try and follow that with the goal to keep the youth within Alameda County and keep them as close to their connections as possible.
Awesome. So let's talk a little bit about some of the challenges that we know happen with youth. Let's talk about AWOLs first. So from each of your three perspectives, how do you, from your agency's perspective, support, address, work with your partners, work with the family regarding problems with AWOLs? Who wants to go first?
Well, I'll jump in. The key is working with our partners. So certainly take our lead in an AWOL situation from the probation department and the youth probation officer. They're often very clear about whether the AWOL has been a demarcation point that the youth's going to have to go back into another form of care. Certainly work with the families, and we end up building a significant alliance with the families. So I want to drill down on what happened. Why did the youth run? Did they reoffend and they thought they were going to, get caught or something, or did something happen in the home? And I want to know what happened in the home. Was there some way that we could have kept the youth there? What went down? I think that's really important. I think whenever there's any kind of a special incident with the youth, we've got to go back and look at what happened, what went down that caused this behavior, that caused the, what did they run away from? Maybe it was running to something, but what did they run away from? And that would be where I think our focus and our emphasis is. If we have, contact information and can contact the youth, we would certainly do that. And our social worker would take the lead on trying to find out where the youth is, see if they're safe, see if we can get them to come back in, provide whatever level of support we can. And then whether the placement continues is really dependent on the probation and the court. That's not our decision.
Yeah, and I would say that we continue to want our youth to remain in the community. And as Jill stated, it has a lot to do with, the circumstances of the AWOL and whether or not, the youth has reoffended. But we try our best to resolve warrants and that type of situation without bringing the youth in custody and without disrupting the placement process. So if we can possibly get the warrant resolved, get the youth to go to court and address the matter without removing from the home, without that disruption of them going into the hall. That's really our primary focus. So we do continue to remain in communication with family builders for youth who are going through the RFA process to see if we can resolve it without the youth going into custody.
Okay. And Jen, how about for families? What's your advice? How do you guys, what's your reaction to that?
So I think that, from a caregiver perspective, I think there are things that they can and they can't help with. Obviously, training is huge, and having the right types of services and support is huge as well. I know that some agencies offer, I guess, to keep up the rate, or that they keep paying the caregiver for a set amount of time to keep the, quote unquote bed open, or to keep the placement open for a specific amount of time as they reach out and try to re-engage and, bring back the youth. And so depending on the placement and the situation, obviously the needs of the youth and so on, having that kind of harm reduction approach to, and having a conversation about what is going to happen, or what could happen, what are the next steps, that in what time frame could the youth come back, call and come back into care, and what happens then, having those types of discussion. I know with the youth, one teen that we had for almost a year, she had our placement, they said, was the only one that she hadn't AWOL'd from. In the child and family team, because she had been homeless and so much instability in her life, and she was an older youth, there was a need for her to kind of, I don't know what the right word is, maybe escape, or she would go to a friend's house that we had identified as a safe place. It was a family friend, one of her other supports, that she was able to do this when she wanted to or needed to. And we had a process where she could, obviously everyone would know she's at so-and-so's house, and we know this is a safe place, or at so-and-so's house. And there was we had very frequent child and family team meetings. And so we had talked through a lot of the situations and kind of this creating a safety plan, so to speak. So that was kind of more of an intensive placement, but all of that helped. And I don't know if this is best practices, but in her situation, I gave her a very large allowance once a week. So it was kind of taking it week by week to keep her in care and on the wagon, so to speak. She was actually pregnant at the time. So it was even kind of doubly important that she stay safe, stay in placement, stay sober. And so, and just kind of taking it week by week. But that's, I call that kind of holding, the caregiver really engaging. And a lot of that just requires a lot of training and support, I think.
Yeah, yeah. And in that situation, for example, Adrian, would you not violate then versus violate, that she had violated probation, for example, or would you not violate because that was also part of the CFT discussion in where she would go when she needed to feel safe and take off? Does that make sense?
I think I understand what you're saying. I mean, I think as long as those parameters, those specifications have been made prior to the placement, I think there's some understanding of what's needed for the youth. And again, we don't want to, we try and really minimize technical violations. And if we know where the youth is and the youth is safe, we have some discretion over that. We just really want to exercise communication with the youth and encourage them to be in contact with their probation officer so that we have an idea of what's going on. And then I think that a violation may not be necessary, but we just need to be engaged and remain in communication with the youth.
Great. And Jill, I could picture that working well with the way your agency functions, as you were describing what you do too, the kind of in the example, using the example that Jen gave.
Absolutely, absolutely. And if it was really worked out ahead of time and in CFT, maybe we could even get the other caregiver fingerprinted, so it would be okay if the youth was to go there for the weekend and we knew that. I think it's a great model. I think it's a great recommendation. Most kids need to get away from their parents at some point or another. And so if we can get a secondary place where it's safe and it's approved and their probation officer and social worker knows where they are, it's a win-win for everybody, but most importantly for the youth.
Great, great. There's a question from Belky saying, is the 20 caseload size for DPOs, so I'm assuming this is for you, Adrian, is the 20 caseload size for DPOs completing the RFA process or for DPOs supervising youth placed with an RFA?
So again, our goal is to have family builders complete the process. There are times where probation will have to take over, but our two DPOs who are involved in RFA are involved in every part of the process. So they're the only ones who would be supervising the youth and if needed, do any part of the RFA process on behalf of probation.
So I think what they're asking, and Velky, feel free to go off a mute and just confirm this. I think what they're asking is, for carrying a caseload of 20, does that mean while they're going through the RFA process, or once the family is approved for RFA, they've only got 20 cases, or is it 20 cases total, whether the family is in process with completing the RFA approval or not? Velky, is that the question?
Yes, that was a question. Thank you.
Mm-hmm.
So they're there from beginning to end. So from the time that the court is considering the RFA and we're doing the emergency approval, they're there from beginning to RFA is approved, the youth is officially placed. They're there the entire length of time.
And that's a 20 caseload, 20 youth caseload size.
So I'm giving you the approximate caseload numbers, but we don't have a set cap
Okay.
at this time. So I'm just giving you an idea of
Approximately.
what the average caseload size is at this time.
Okay, great. And then Anna has a question. Who identifies the family? Does Family Builders do the family finding efforts, or do they only work with the referrals from probation?
We do both. So if the court or the probation department or the public defender has identified a relative, then that's where we'll start, particularly if the court's made the decision that's where they want the youth to be. If no one's been identified, then we start, with our basic family finding and talking to the youth and the probation department and public defender and everybody and anybody known to the youth to then try and identify a caregiver. And one of the interesting things that's been sort of a learning curve for us is our permanency model we've used in child welfare for many, many years. And in child welfare, it's kind of black and white. Either the youth has family or they don't. In the probation system, sometimes the youth has permanency, but the youth can't be there, often related to their probation. So we had a youth who was totally, loved and enmeshed and connected to his mom, his birth mom. He lived there all his life, had a wonderful relationship. But the youth got gang involved and the gang was shooting up mom's house. And so mom said, you can't live here. And so we needed to find somebody else where the youth could live, but the youth had permanency. There was no question about his relationship with his mom. He had solid permanency. So that's been a little twist for us on kind of a learning curve in doing that. And we will step in and we'll do family finding and see if we can identify, another relative or someone else to be the temporary caregiver for the youth.
Okay. And so in that example, that would be a temporary kind of plan until things are stabilized with mom. Is that what you're saying?
I think that would be up to mom and the probation department.
Okay.
It might be the youth's duration on probation. But
yeah.
So much.
Okay. Right. Okay. So let me give you guys another topic then. Let's talk about theft a little bit. And I thought what you said, Jen, was very interesting with giving a larger allowance, trying to keep her safe. And we know that, for instance, CSEC youth often do the activity to get money so they can do the other things they want to do or purchase or whatever. But I also know of youth that don't take a lot. They take the change off of the dresser. They take, they see money on the table and may take it, all the way to, stealing from a store, stealing, and we know youth that take really minor things and youth that take very large, expensive things. And so there's the whole gamut. But can you talk, Jen, a little bit about that from your perspective and how you came up with the give her a little bit more money, but also just from the perspective of theft in a foster home?
So again, I think, again about, a resource family being trauma informed, so a non-related foster parent would, most likely become, or hopefully become a foster parent because they, they want to help change a young person's life. So we assume that people aren't doing it for the money, although that's kind of a tough stereotype, kind of stereotype to overcome. But I don't know how you can make money doing it, but apparently some people, they feel like they can. I think that that you, with all of our kids and youth, you take some risk, and a resource family, I would think, knows going into it that there are certain things that you are opening yourself up to, or that there might be some risk involved. So I think that, being able to structure your time and your house and everything in such a way to prevent you losing things, that are taking a youth to a mall and providing supervision so they don't find themselves in a situation where they're tempted. So, and non-probation youth, will steal as well. So
Yes.
it's not so a lot of it just kind of boils down to parenting and being smart in how you what you're opening yourself up to.
And is there anything specific
Can I add to that, Kim?
Oh, sure.
So I agree, and I think it was great wisdom on Jen's part to give the youth additional allowance. I think one of the first of all, the trauma-informed piece, and one of the purposes for pre-service training is so families do understand what the youth's history, what their needs are. They understand trauma, they understand grief and loss. And when you've had a lot taken away from you, sometimes you take things from other people. It's a very logical consequence. One of the things caregivers have to do is they have to acclimate to the needs of the youth and not expect the youth to 100% acclimate to the family. There's got to be, give and take there. We had a situation, it was a youth who was on probation, and the caregiver was the parents of the youth's best friend. And they agreed to take the youth, and they went through the process, and we approved them. And within a very short period of time, a couple of weeks, the youth, and I quote, stole alcohol from the family. And my understanding was the alcohol was sort of free and clear. It was sitting out around the house in the home. And I'm sorry, basic parenting is you don't have alcohol around when you got teenagers, no matter who the teenagers are. It's just too tempting.
Yeah.
It's
like a setup.
So, yeah, it is. It's a setup. And why would we set the youth up for that? And everything in the house shouldn't be under lock and key, but come on. And then the family's reaction was really, really inappropriate. It was much too harsh, very inappropriate. And it was immediate disruption, which was in the best interest of the youth. But that's where families have to kind of step up too and think about what is their responsibility. What does this youth need? Don't have the alcohol just laying all over the house and then get mad when the youth takes some. I mean,
Yeah. Thank you. Thank you. So there's another question. Are there any suggestions for supporting juvenile sex offenders in reaching permanency? Oftentimes the victim is in the home. And where I'm noticing the time, so we have about just a few minutes left, but just talk about recommendations and suggestions.
what I would say first is we need to hear from probation whether the youth can be safe in the community and whether the community can be safe. And then they probably need to be in a placement where maybe there's no other children to start with. I mean, I think there's a lot of precautions that can be taken. And then you want the youth personalized treatment. That's first and foremost, is the youth needs to be in treatment and have the care that they need. And also treated and seen as a victim themselves, because most of the time that's where, you know, a juvenile sex offender gets their behavior from.
Adrian, any comments?
No, I think that, the key to, any youth, whether they have committed a sex offense or any other offense, is to start all of those efforts, family finding and all of that, as early as possible. That's why we're able to provide, referrals to family builders before we even get to the point of out-of-home placement. And I think it's really finding that supportive person for that youth early in that process, and someone who is invested in that youth, invested in their well-being, and really willing to partner with the youth and remain that supportive figure throughout, their time with us and beyond. And so I don't have a magical answer in regard to that, because it's a very difficult situation to have a youth who is a sex offender with a potential victim in the home. So there's a lot of assessment that goes with that, as far as even the ability to return to that environment. So I think all options have to be explored, but the earlier you can start the family finding and find that support for the youth, the better.
Jen, what about for you from the family perspective, caregiver perspective?
Well, I mean, my reaction would be that I would think you wouldn't want the youth in the home with the victim. I don't, but the situations, I've heard of all different kinds of situations. I would just say that my first thought is to, when dealing with young people, we know the brain is still developing and has time to heal and rewire itself, and getting those intensive services in early so that the youth can go on to have a successful life and not continue to fail or hurt other people is an incredible opportunity. So I think in those situations, you definitely want to have a really good supportive environment, and I think for licensing for resource families, that you wouldn't be able to place them together, the youth with the victim. Yeah, I think that with young people, I think there's, hope and a lot that can be done. And a good opportunity for resource parents to really impact a youth's life, especially in that circumstance.
Yeah. And so I would just kind of, for closing comments from a comment from each of you, I would be remiss as a licensed mental health clinician and working for CBHDA and not asking you just a comment about how you see the value of partnering with your agency, the placing agency, the caregiver, but also the mental health providers in this situation. I'll start with you, Jill.
Absolutely, 100% essential. And fortunately, in the Bay Area, we have a plethora of mental health providers, and we're usually able to get youth services immediately. The probation department often has those kind of teed up, or they're already involved, and it's absolutely core essential.
And Adrian?
I definitely agree. I will continue to push the need for collaboration amongst probation, any providers in the community, definitely mental health. Everyone has to kind of work hand in hand, and it's just, you know, further exemplifies our commitment to our youth and just giving them the services, the well-rounded services that they need to be successful.
And I should have added education and regional center too, because so many of our children and youth today, well, they all should be in school, and many of them have regional center needs as well. So Jen, what are your final comments in relation to the partnerships with all those other agencies?
Yeah, they're so important. I think one agency can't and really isn't meant to provide for all the needs of the youth. And really, I can see, you know, probation needs other community-based services and partners in order to, you know, do their job well, basically, for the best outcome for the youth. And that, you know, the collaboration and partnerships and really ensuring that the youth can tap into every single, you know, service and resource and support that is available that they could potentially benefit from is going to provide the best long-term outcome for them.
Great. Well, I want to thank all three of you for your time and your commitment to serving youth. What an important role you guys play, and working together makes all the difference in the success for those kids. So thank you both. We'll do some clapping for you. So I just want to do some closing comments. Thank you guys all for joining us today. You will receive the evaluation that we'll want you to fill out, but it will not come till the end of the conference. So it's not like going to be the end of this session immediately. And I forgot to say that all three, Jill, Jen, and Adrian's bios are in the conference package. So when you registered for the overall conference, their bios are all in the package. So do check that out as well. Tomorrow morning, the session begins at 9 a.m., the general session. And so we hope to see you there. You'll first hear from DSS about Families First Prevention Services Act, and you know that as FFPSA. And you've heard a lot about FFPSA by now, and DHCS will be there to talk to you about it. I again want to thank you all for participating, and thank the three of you, our speakers today. You guys did a great job and clearly are helping the youth in the system today. So thank you. And that's the end. And it looks like there is, oh, and great. Thank you for attaching, Jen, the newsletter. So just before we close it, close everything off. And those of you that are watching, please, you can download that newsletter from the chat box from Jennifer. That would be great. Thank you all very much for coming, and see you tomorrow.